All right, so if I was hired into a nursing home and I saw that most of the residents who wore dentures had calculus buildup and staining on them, my first step would be to take it to a dental office and get it professionally cleaned. My next step would be giving a presentation, and I would have a slideshow presentation and a printed version of it as well. I would also have a printed checklist of a step-by-step on how to clean the dentures, and I would hand that out to the med aides, and I would also hang it up in the residents' bathrooms who wear dentures. That way when they clean it, it can be right there in their bathroom. I would have printed out a list of products and where to get them and their prices, and I'd also bring products to give to them to start out with. So with most of the residents wearing dentures, knowledge of proper cleaning and how to take care of them is very important. The main goal is to remove biofilm and debris, and doing so, removal of that will provide comfort and lasting tissue health, and it would also prevent caries of natural teeth for those who wear partial dentures. When the biofilm and debris is not removed often, it can act as an irritant to the teeth and tissues, and it can also cause oral lesions under the dentures, which would not be good. So the steps for partial and complete dentures are kind of the same when it comes to cleaning. The only difference would be when it comes to the brushing step. For residents who have the partial dentures, you'll want to take a regular toothbrush or a power toothbrush and brush your natural remaining teeth. Those who wear complete dentures obviously don't have natural teeth to brush, so they won't need to do that step. But other than that, all the other steps are about the same for each of them. So the first step would be rinsing, and rinsing is important to do after snacks and meal times. And so for partials and complete dentures, you'll take out your prosthesis and you will rinse under fluoridated water, and then you'll rinse out your mouth as well by just switching it around. And this is just kind of loosening up the biofilm and getting rid of the loose debris in there. But it is important to remember that rinsing does not remove the biofilm. So that's where the next step comes into play. Step 2, which is brushing. People who take out their partials needs to remember that it can bend and it can break if you drop it, so you just need to be careful. And to kind of prevent it dropping, you can fill the sink with water and then line it with washcloths. That way if you do drop it, it kind of acts as a cushion. So those who have a partial denture, it is recommended to use a clasp brush, and you can get these at grocery stores. The brand-wise, there's Equate, Oral-B, or Fix, and the Gum brand, and the prices I saw were $4 and up. Let's see, and then for complete dentures, you'll just want to get a normal denture toothbrush, and then you'll just brush it like you would your normal teeth. And then step 3 would be immersion, and this is the last step. You'll want to do this daily, and it is said in the book to do it overnight. So once you have removed all the debris with rinsing and brushing, you'll want to fill the plastic container with warm water and cleaner solution. It's important to not do hot water because that will distort plastic resin. And then you'll want to follow the manufacturer's directions for dilution, and then you'll want to fully submerge the denture into the solution and then close the container lid. And then you'll keep it in overnight to let it soak. And then once you remove your denture, you'll want to rinse underwater to get off chemicals and loose debris. And then next you will empty and clean container daily, and then you'll want to mix fresh solution each time you let your denture soak, just for sanitation purposes. Some brands for the cleaning solution is Polident, Effordent, and Equate, and these were also $3 and up. So yeah, that's my step-by-step.